my name's Pat Kelly. I am a practicing vascular surgeon, as well as the managing director for BlueDop. How many of you guys have been to our booth already? Good, good. So now we want to see how BlueDop works, right? So let's talk a little bit about BlueDop real quick, and then we'll pick on Nan here and see if we can figure out how to advance this. So vascular disease, diabetes, it's becoming a world epidemic. You know, around 200,000 or 200 million people in the world have vascular disease. Most of those people have diabetes. The challenge with diabetes is that diabetes can affect the blood vessels to make it very difficult to assess the perfusion or the adequate blood flow to that limb by calcifying the blood vessels, as well as significant edema. All the things that we do to try to figure out if somebody's got enough blood flow to that lower extremity. Historically, we've used ABIs, ankle brachial indexes, or ABPIs, and we do it by placing a blood pressure cuff on the arm as well as a blood pressure cuff at the ankle. That is fraught with inaccuracies, as we all know. Until we tie it to a waveform, it's not very helpful. The problem with a waveform is if you don't take care of patients on a regular basis, and if you're not a vascular expert, that waveform may not mean much to you. But there's a solution now. Now we can make everyone in this room a vascular expert, at least from the assessment of perfusion. And that's done with BlueDop. Let's look at this little
Millions
bit.
of people suffer from vascular disease, and that number is rising. Diagnosis is complicated, inaccurate, and really hasn't changed in over 50 years. Until now. Introducing BlueDob, a faster, easier way to detect vascular disease in lower limbs. It takes a revolutionary new concept, pressure from flow, and mixes it with 50 years of research experience to create a game-changing ABI triaging system. In an ABI test, a blood pressure reading is required from 2 arteries in the ankle. Conventional ABIs without a waveform are time-consuming and inaccurate, leaving the provider with a clinical dilemma. This is partly due to the fact that up to 30% of patients are diabetic and don't respond well to blood pressure cuffs due to ulceration and incompressible arteries. BlueDob is different. It uses a conventional Doppler probe housed inside a rechargeable, easy-to-clean blue egg. BlueDob converts waveforms to information that's actionable to any healthcare worker, not just vascular experts. And it does so with the patient lying down or sitting up without using an ankle cuff. That means greater comfort for patients and more reliable information for healthcare providers. Wireless technology lets the Doppler probe communicate information to a tablet. Here, special software analyzes the Doppler waveform and provides quick, easy-to-interpret results. The entire test can be done in far less time, and the results are instant, meaning less time is needed for vascular consultation and waiting in queues. With BlueDop, instead of seeing 2 vascular patients per hour, you can now see 6, which gives you the time and peace of mind of knowing you're treating patients for the correct diagnosis. Better efficiency, better accuracy. BlueDop. Schedule a demo today and see the future of ABI testing and vascular diagnosis.
This working again? Perfect. So BlueDop, as the video showed, we took a standard Doppler probe, we placed it inside a case with a recharger with a Bluetooth generator that interacts with our tablet. Our tablet has intelligent software that from just that Doppler waveform will give you a mean blood pressure. From that mean blood pressure, we can now give you a ABPI, not an ABPI that is compromised because of incompressible blood vessels or swelling, but an ABPI that is based off the patient's Doppler waveform. We can give you now from that the perfusion pressure. How much blood is that foot really seeing to give you confidence that you can heal a wound? We want to see a perfusion pressure greater than 40. We also give you what's called a vascular reserve. The shape of that waveform tells us how the capillary bed is responding to that perfusion. And is the capillary bed starved for blood flow? or is the capillary bed fairly satisfied? And that tells us that reserve. Is that reserve 50%? Is that reserve 90%? Are we only using 10% of the blood flow? So that's BlueDop. Again, the egg, we refer to this as the egg. This is our Doppler probe. And then this is the future. For any of the vascular interventionalists here, we will eventually move this to real-time feedback as you're revascularizing a limb. So I think several of you have come by our booth and you wanted us to show a demo, and I promised you a demo. We have Nan here. We're going to ask Nan to lay down, and we're going to show you how BlueDop works. So I already did it. Like any good presenter, you always want to make sure everything's working before you do it. So we already did this once, and we said she has a blood pressure of 110/70, and we were able to obtain a good Doppler waveform, a multiphasic waveform. For the vascular experts here, it's a triphasic waveform versus a monophasic waveform. BlueDop tells you that. It analyzes that waveform, and we look for either a blue box here or a black box. The blue box says, I can analyze that waveform. Once I have that, then we try to make it simple. What are people used to seeing? Most of us drive, and we're pretty comfortable with stoplights, so we have green, yellow, and red. Green means it's normal blood flow. Yellow means there's some arterial disease, but it's not terrible. You need to pause. Red means this patient has significant arterial compromise that needs to be looked at further, and probably referred to a vascular expert. It gives you a mean blood pressure. It gives you the ABPI in percentage. Now it's the mean ABPI, so it's going to be 1 or it's going to be or less. And then we're going to give you a perfusion pressure. We're going to tell you how much blood's really getting to that foot and should it be able to heal, and then we'll give you the vascular reserve. So I'm going to hit reject because we want to do it again. And I'm going to put this over here. And I'm going to turn my egg on. So it interfaces with that. See that? Okay. Use some gel. She's got a non-healing foot wound. You see the sore on the toe. So we need to check vascular blood flow. I'm going to have her rotate her foot just a little bit so the gel doesn't run all off everywhere. Thank you. It's always good to have a patient be an assistant at the same time. And then I look for that waveform. I start usually at the malleolus, and I slowly work my way back towards the calcaneus. And you wait till you get a reading, and you stop. So we have a triphasic waveform. She has an ABI of 0.99. She has a perfusion pressure of 8.2 and a reserve of 97%. Now, you say, well, her last one was 0.94. It's going to vary a little bit, and I'll tell you what, that is technician. I am a vascular surgeon. I'm not a vascular tech. But it shows that even somebody who doesn't do Dopplers on a regular basis can quickly learn this. Okay? Okay. Come up here. Yeah, you. You ever do a Doppler before? Good. Today is the day you learn. Okay. So we're going to reset this. Okay? And then what I'm going to ask you to do is hold the probe, put a finger right there, start here, slowly just slide it over, watch the screen until you find it. Now I'm going to stop before it analyzes it too quick. Now you try that. Okay?
Just press here, yeah?
Nope, don't have to press any button. You just got to hold the probe. Just hold the probe. Just hold the probe like this.
Okay.
Yep, you want to hold a little bit of an angle. And you want to rest one finger here, so you want to hold like this with a finger like that.
Okay.
Yeah. And very gentle, just float on top of the skin. And you slide back. Okay, you hold it right there. Got to move just a little bit. So we're going to go right about there, I think. There. In less than 2 minutes, you're already on your way.
Yeah.
Pretty. Go ahead.
It's pretty easy.
You did good. Good job. Boom. Thank you. A little bit of skill, not probably, usually we find it takes about 20 minutes for somebody to start that skill set. Okay, you just got to float over the skin. You usually put my pinky down. That's BlueDop, guys. I mean, I'd like to tell you for hours and hours how great BlueDop is, but really BlueDop's going to tell you how great it is in about 10 minutes because it takes about that much time to assess your patients.